25 million people continue to be exposed to asbestos in the workplace.
So there's a big cost to humans using asbestos in dollars and lives.
Research that goes into these decisions has to be directed by independent, unconflicted scientists.
It's not something that just affects workers, it affects everyone.
Saving one life is great, but saving many more is what I hope to accomplish.
Making a profit off of people's pain and lives is wrong.
We can't quit, not as long as there are hundreds of thousands of people still to be diagnosed.
Ban the asbestos once and for all.
The next speaker is Alec Farquhar of the Asbestos-Free Canada to tell us about some progress in that country.
Is this my control here? Yes. Okay. Hello, everyone. I'd like to start by asking all the Canadians here to stand up. Everybody. That includes Louis. You gotta stand up. So, and these are among Canadians who've come to the ADAO on numerous occasions in some cases. And it's a proud, proud day for us to be here with the message that we're going to be bearing. I just happen to be the person providing that message. Many people contributed. There are people in this room who've been contributing for more than 40 years. We dreamed of this day. We dreamed we could do it, and we know you can do it too. So we're running over time here. I'm going to try to save Linda a little bit of time. I'll go pretty quickly because you're familiar with our story, probably more than these other powerful stories here that many of us have shared in as well. So just a little bit of background in Canada. Like so many of the countries, it's complicated what was going on. We were the first global scale producer and miner starting in the 1880s, a long, long time ago in Quebec. So the roots run really deep. The industry was tremendously powerful in Quebec. If you think of other parts of the world where one industry dominates everything, that's what the asbestos industry was in Quebec. They could buy anybody. They could buy scientists, they could buy university professors, they could buy doctors and politicians, and they did so. And strangely, very strangely, the industry grasped the, we'll say the soul of the rising generation of French Canadians who call themselves Québécois, who were rising up against their 2-century-long domination by the English in the period after the Second War. They were called the generation of the Silent Revolution, a peaceful revolution where Francophones became dominant in Quebec after 2 centuries of essentially being a colonialized people. One of their young leaders was Pierre Trudeau, and in 1949, in fact, it turns out Dorothy Wigmore brought the book from Canada. You can see it at the back. Pierre Elliott Trudeau, the father of our current Prime Minister, was a major player supporting a strike by the asbestos workers in the area of the mines in Quebec. And they were rising up partly because of health and safety conditions. Most of them were women making textiles. And this grasped the soul of the generation of Pierre Elliott Trudeau, who ended up becoming, of course, the dominating generation in Quebec and in Canada. So in a strange kind of way, because of that development, there were people who were blind to what asbestos was doing to the very people who had asked for their help a number of years earlier. So this meant that all our major political parties on the national level in Canada supported the industry for a really long time. And I was so moved to see that terrible photo from Brazil where workers are turned against workers, where people are turned against their fellow citizens out of a desire to maintain their jobs. And of course we understand why people would want to maintain their jobs, but some of what has been done in that cause has been truly terrible, evil, and unacceptable. We knew the hazard of asbestos just like you did. We had our Johns Manville factory. When I was a young law student in 1973, I first met the workers there. They were just starting to experience the same things as everywhere else. I think Dorothy was involved with them as well at that time, so that's almost 46 years ago. I vividly remember, and I hope I'm not misrepresenting the memories, at least one, maybe two of them committed suicide That's not often talked about. We have brave warriors here who fight to the end, but there are some, and not to blame them whatsoever, who give in earlier, and unfortunately, suicides result. And we have succeeded in getting workers' compensation in Ontario for some of these deaths, because of course they are linked to the emotional impact. So we had a royal commission that started in the early 1980s called the Dupre Commission. Still available in an archive form, very, very interesting. You could dust it off, take it to India, take it to lots of other places, and it would be completely relevant today. It's a beautiful piece of work by a very dedicated team that came forward 34 years ago to recommend some of the things that still are not implemented in Canada and the US. It's a tragic failure of public policy. We don't lack the knowledge, we just lack the political will. The truth is, asbestos is hardly used for new purpose in Canada today, and for many years has not been. That's because the liability costs were so great. So even without a ban, no one should think we didn't make progress. We did. Made a lot of progress on the regulation of asbestos, and especially on workers' compensation for it. I'm just giving you a little bit of an idea of Ontario, where I've been active and very involved in some of this. It's strange and interesting for a Canadian to come here because there are so many crucial differences between our systems. We have pretty well everything public. Not to say it's perfect, but we have a one-payer healthcare system. No one with mesothelioma in Canada, no one with a serious cancer, and I will say, there was a comment quite understandable this morning from another person from Canada, I think feeling that our medical system has failed that person, but there are lots of fantastic doctors in Canada, top world-class people dealing with mesothelioma and other asbestos diseases. It's just that it's patchwork. So someone can encounter a lack of medical support, or they can encounter a lot of medical support. And believe me, in Toronto, we have a lot of medical support. And our Canadian Mesothelioma Foundation, and UDIS is sitting right here, we're working hard to make that true on the national scale through a mesothelioma healthcare network. But I'm mentioning to the American audience, none of these patients are worried for a minute about their health care, not for a second. They don't pay for that health care. It's free. You can be rich, you can be poor, and you walk in that hospital door and you'll be treated the same. Very important. So it shows you how an issue like health care, and I have to say, the failed American system, there are lots of systems around the world that at least do that right, and I think we certainly do. Another thing, I'll just mention it briefly, it's not a criticism, believe me, but public workers' comp system has another benefit. The vast majority of mesothelioma victims in Canada don't have to go to a lawyer. They walk in the door of the Workplace Safety Insurance Board, and this regulation that I personally had a big role in implementing over 25 years ago says that if you can prove any exposure to asbestos ever on the job in an asbestos exposure industry, and then you later get mesothelioma, okay? You are irrebuttably presumed that it's work-related. That means your claim goes through without question or doubt. Your employer is not allowed to lead contrary evidence. We brought that in under a center-left government in Ontario in 1993. I personally lobbied cabinet ministers to get it passed. It's one of my prouder achievements. It was a recommendation that came straight out of our Dupre Commission that I mentioned earlier. Nothing mysterious about it. So we have lots of community clinics up in Ontario where mesothelioma patients literally walk in off the street and have their compensation approved on site instantly. Instantly. So there are other worlds, and again, Ontario's not perfect. We've got a mini Trump up there now. Having said that, hundreds, and in fact thousands of mesothelioma victims have never had to worry about health care, and they've never had to worry about compensation. And the boards hire an American law firm to come to the trust funds, and if the trust fund generates a surplus, then the victims get the surplus. But they don't have to worry. From day one, they've got their health care, they've got their compensation. And lots that comes with it. Home care, supports, again, not perfect. but there's a lot there for them. I also played a role when I was Health and Safety Director in the implementation of our regulation on asbestos on construction projects. I would like to be able to say that in Ontario they don't wear suits of the atrocious quality that we saw here this morning. I know it's not perfect. The bigger projects are well done. I've got 2 minutes, I better finish. Lots of other free resources. Our network of health clinics, our tremendous mesothelioma project at the University Health Network, ongoing screening, support for a ban. It's gone deeper and farther year by year by year, and sitting right in the audience is Sandy Kinnard. I've got a link here, which I don't have time to go to, but you saw the photos from Louis Palou earlier. Massively important in the early 2000s that millions of Canadians saw these photos. And I'll add, Louis' photos from India made us really humiliated on the world stage for the exposures we were visiting on vulnerable people in other places. It was a big, big impact, and thank you, Louis. Thank you, Sandy. Growing consensus. Finally, the political parties changed their positions, including the New Democratic Party and the Liberals. People stood up in Quebec finally against the industry. A lot of great things happened. And the Quebec government stopped supporting the industry in 2012. The last asbestos was mined in Canada in 2011. That's getting to 8 years ago. Here's some editorials. You can have all this on the website. Here's the asbestos ban regulation. There are gaps in it. We're not dealing with the tailings very well, and there's a fight to be had on that, but overall, we've got a ban in Canada. Where do we go from here? You can see here an outline of our current proposal for a comprehensive strategy. Those who have a chance to go to Australia will see that they've got an agency there responsible for asbestos eradication. I think it's pretty good. We want one just like that in Canada. We want a full strategy. You'll see it has a registry, protection for remediation, support for transition of the affected areas, and also the research and innovation through our mesothelioma healthcare network. So thank you to everybody. A few stood up here. Many have passed. Families, victims, activists have all played a role. People have had sit-ins. People have had wildcat strikes. People have taken collective action. Amazing things have happened in our country, as they've happened in India and other places like Brazil. Some of it has not been pretty. Some of it's been tough. People have risked their careers. We had that ridiculous spy, Rob Moore, come and trick us in Canada like he did in other places. These people played dirty. They will continue to play dirty. We have to stay strong. We will stay strong, and you can do it too. Thank you.